Hi, this is Dr. Paul Nyheiser from Allied Vision Services in Plainsboro. Wanted to talk to you a little bit about myopia or nearsightedness. Nearsightedness is a common eye condition that makes seeing distance blurry. This is the typical reason people will get glasses in order to see the blackboard or to drive to see better far away. Myopia afflicts about 30% of our population in the United States, so about 100 million people. In parts of Asia, that rate of 30% is close to doubled. This is a big worldwide problem. It is affecting about 2.5 billion people in the world right now, and in one more generation, it'll be about 5 billion people. That's a lot. That's an epidemic. Traditionally, nearsightedness has been treated with eyeglasses and contact lenses. And if you had asked me earlier on in my career, what can you do about myopia? The answer is not that much other than put your glasses on or wear your contact lenses. Now we know through lots of research there are some measures that we can take in order to slow the nearsightedness down, to slow the onset and to slow it down from progressing each year. We know that there are two things mainly that contribute to nearsightedness. One is genetics. Genetics meaning if mom or dad are nearsighted, the child is much more likely to be. And environment. Environment means how you use your eyes. Kids who read much earlier than previous generations. Kids who spend time on electronic devices, iPads. During the pandemic, we saw people spend much more time on computer screens rather than going to functions like school or work in person. And all that close-up stimulation, all that close-up looking tends to make eyes more nearsighted. So let me discuss a couple of things that you can do that everybody can do at home in order to slow this down. One, cut down the amount of screen time that you do, amount of time that you spend on the computer screen or tablets. Of course, everybody has to do some, whether you're in school or whether you're working, but you can set limits on that, and we encourage parents to set limits on that for their children. We encourage kids to play outdoors. What we all did when we were little kids isn't done so much anymore. And by that I mean usually kids came home from school, they went outside to play. Now kids come home from school and they get on their computer or they play video games. So research has shown that the more time spent outdoors, the better it is for slowing down the nearsightedness. So that's an easy thing to be able to incorporate into your day. Another thing we tell everybody to do is take a break. So after about 15 minutes, 20 minutes, look away from the computer screen. You don't have to physically get up and walk away, but look away from the screen for about 20 seconds and then go back to what you're doing. And if you can do that every 15 or 20 minutes, that relaxes the focusing muscle and again reduces the amount of nearsightedness that your eye is basically building up. There are things that we can do to slow down the progression of nearsightedness. When you come and see us, we evaluate your eyes, we measure them, we see what happened to the prescription since the last time you were here, and if it looks like it's taking off or it looks like it's changing in large amounts, or if there's a strong family history, we'll talk to you about myopia control. The ways that we can help you with myopia control are, number one, dual focus contact lenses. Dual focus contact lenses work by slowing the growth of the eye. A nearsighted eye is an eye that's grown too fast. So those lenses fit properly and in a certain way will slow things down by about 50 or 60%. That's a lot. We can use dilute atropine eye drops. Easy to use. We use them before bed. Minimal side effects. Of course, we do a lot of follow-up on the children that start atropine to make sure they're not having side effects or reactions to the medication. How that works exactly, no one really understands the mechanism, but we know it works, and it also works by cutting myopia by about 50 or 60%. It is a safe medication. It's been used for many, many years to dilate your pupils and for other treatments of certain eye disorders. So it's not a new drug. And in fact, it's an old drug, but it's dilute. So instead of 1% atropine, you're getting 0.01 or 0.025%. So it's a very weak medication, but it works. Another method is combining the two. So if we start someone off on the dual focus contact lenses and we're not getting enough myopia reduction, we can incorporate atropine. So we can use both. Another method is to use multifocal eyeglasses. That is probably the least effective of all methods, but it's better than doing nothing. So these are ways that we can try to slow myopia down and try to reduce the amount of people that have severe myopia, because along with high myopia come complications like myopic macular degeneration, increased risk of glaucoma, increased risk of cataract, increased risk of detached retinas. So nearsightedness is not a benign out-of-focus disorder. It comes with some serious ramifications. Next time you're in our office, if you would like to speak to us about myopia control, please do. If you want to set up a consultation with myself or Dr. Wong, my associate, we'd be more than happy to talk to you about that. Thank you.